as the nation grapples with its deadliest period of the pandemic, with hospitals still in crisis.
These nurses, they are exhausted, they are worn out, they are sick, they are tired.
Fresh hopes New South Wales, Victoria and Queensland are climbing down from their peaks.
It does look like we're at or near the peak now, so hopefully we'll start to see a decline, but we're not going to go back to zero, so those case numbers are going to continue climbing for some time.
As daily case numbers drop in South Australia, that state is looking to ease restrictions.
You will see fluctuations, but the good news is that 7-day average is significantly reducing.
With the start of school rapidly approaching, Victoria has announced walk-up vaccine hubs at primary schools around the state.
15 this weekend, 15 the following weekend. It's not just for students, it's for staff, it's for parents, it's for people who live in that local community.
The Premier again pushing for fully vaccinated status for adults to be redefined to include a booster.
This is not 2 and a bonus, 2 and an optional, it's 3.
That comes as New South Wales admits only 36% of the eligible population have had their booster shot, with hundreds of thousands of appointments going to waste.
Go and get the booster. We know it works. It works to keep you safe. It works to keep the community safe. And of course, it works to take the pressure off our health staff.
Fortunately, Nat Cab is back on today, and our leaders have fixed everything, right?
Okay, you guys want to go? Thank you.
After the usual Thursday Arvo Zoom call, there wasn't even a PM press conference. No changes to the list of essential workers or ISO requirements, and no change to the fully vaxxed definition.
Well, infectious diseases physician and vaxpert, Professor Paul Griffin, joins us now. Paul, New South Wales almost hit a land speed record for the rate at which everyone got double vaxxed, but now we've only got about 1/3 of the eligible population in New South Wales who've had their booster. What do you make of that shift?
Yeah, look, it was a tremendous effort to get everyone double jabbed as quickly as we saw. And, I'd certainly like to thank those 30-odd% of people that have gone and gotten that booster. But it's clearly not enough. We need to make a concerted effort to go and get every eligible person that booster as quickly as possible. And it's been challenging, I guess, with the interval changing and over the Christmas period, for example. And obviously with lots of cases of Omicron around, people might not have seen what the benefit is. But it's really important we get as many people that booster as possible.
So for anyone who is feeling undecided about getting that booster jab, what does the science say about the real difference that it can make?
We did see with Omicron the protection from 2 doses was reduced, and that's where we introduced that booster, and that takes that protection right back up to what we saw 2 doses do against the previous variants like Delta. So that gives us tremendous rates of protection, particularly from severe disease, intensive care and not surviving the infection, but also helps reduce people's chance of getting the infection and passing it on. And clearly when we have a variant as infectious as this one, that's critically important.
Professor, a lot of us who have had COVID had been told to wait. We could wait, that getting COVID was like a natural booster and we could wait 3 to 6 months before we got our booster. The advice seems to be changing. When is the time right?
What's clear is you definitely need to wait at least till you're fully recovered. And while we previously said up to 6 months might be okay, we've wound that back perhaps to a maximum of around 4 months. But I think probably somewhere in the middle there will be the sweet spot. So maybe at around that 2-month mark would be great to go and get that booster if you've not had it already.
Now, Professor, National Cabinet today didn't change the definition of fully vaccinated from 2 to 3 jabs. Do you think that's something that could be really beneficial and see a lot more uptake?
I think it will be, and I think that will be the case, but it was just a bit soon now. We've obviously just changed the eligibility down to 3 months, so there's a lot of people who are now eligible who've not yet had the chance to get that booster. I think as we see those booster rates climb, that we will change that definition of fully vaccinated to include that booster dose. But I think it's just too soon right now.
Do you think the fact that so many people are getting COVID at the moment has maybe the reason we're seeing a little bit of a stagnation with the booster shots, that people are dealing with it now and they are waiting until their symptoms subside or for that 2-month mark?
Oh, absolutely. We know the case numbers are very high. Probably many times that's actually being reported because of the challenges with testing that we're seeing at the moment. And I think that's definitely contributing. And people will be waiting appropriately till they're fully recovered and a little bit after to go and get that booster. So definitely that's going to be contributing to a degree as well.
For anyone who's had 2 scoops of AstraZeneca, knowing that scoops of chocolate, vanilla and strawberry ice cream combine perfectly, what's the best 3rd scoop of vaccine for someone like that?
Look, I'm a big fan of Neapolitan myself, but I'd encourage people to get individual advice. And with AstraZeneca, the booster predominantly recommended is going to an mRNA vaccine of Pfizer and Moderna. But it's clear that this advice may change as we get more vaccines online, and we're going to have Novavax available as a booster, most likely in the not too distant future. But as we said with the first doses, the best booster you can get is the one you're eligible for and you have access to. So, the main thing now is to encourage everyone to go and get whichever one they can as quickly as possible.
Looking forward to a nice magic vaccine. Oh, nice magic.
That sounds good.
Oh.
Yeah, the problem is that third jab at the moment feels a bit like the strawberry that so many people leave behind in the Neapolitan. But we do have to fix that. Thanks a lot for your time, Paul.
It's a pleasure. Thank you.
Yeah, it's really interesting that, I guess, the numbers we've seen in New South Wales aren't what they were for the double vax. And I think just colloquially, I speak to a lot of my friends who aren't involved in the news, they aren't necessarily right up to date, a lot of them, because they've been so overwhelmed with all of the negative news. So they might be acting on what isn't the most recent advice. They might be
not up to date with how serious it is.
Not exactly. Not up to date with how serious it is, and also how it's shifting, how you can get that boost earlier. So, obviously this isn't everyone. I can't speak on behalf of everyone, but I think that might have something to do with it.
Well, the advice has significantly changed and shifted and backflipped and then been reinstated over the course, particularly of the last 6 months. So if people are exhausted by that, are we surprised?
So we got to this peak quite quickly. I think quicker than we all thought we might. I think Nancy Baxter was saying during the week that the exit out of the peak is going to take quite a bit longer than the entry.
Do we think that it's important to change the definition of fully vaxxed to include a third booster? In other words, starting to limit what people who don't have the third one can do the way that people who don't have two are limited now?
I'm not a health expert, so I'm not saying a word.
It's sort of a carrot stick, isn't it?
Yeah. I see if you've had the two, why wouldn't you go back and get the third? Finish the job off.
Personal responsibility actually applying on that one, maybe. Yeah.